Hi, good day. How is everyone doing? How is work? How is family? Hope all is well. Yeah, it's a good day. Yes, today I want to talk about some basic tests that we do in the lab. Yeah, so I'll be talking about urine analysis. We call it urinalysis. So it means urine analysis, and this is the like this is container that we use for urine analysis. So you label the name, the ID, hospital ID, the type of urine. Yes, because we have some other urine tests. We have urine analysis, urine microscopy, urine culture, and sensitivities. Yeah. So I'm talking about urine analysis today. So, and I will explain how it is being done and what are the things that you expect while doing urine analysis. Yes. Urine analysis is one of the tests that you do, one of the common tests that you do in the lab. Yes, to assess your earth urine with just urine sample. So healthcare normally do urine analysis to screen for or monitor your earth condition. Yeah, and to diagnose urinary tract infections. Yeah. So, a urine analysis, also known as urine test, is a test that examines visual, chemical, microscopic aspects of your urine. Yeah, your urine. Yes, it includes variety of tests to detect and measure various compounds that pass through your urine during single sample. That is amazing, right? Yes. So we use urine sample, that urine analysis, to monitor and screen for some health conditions such as liver disease, kidney disease, and diabetes, and even to diagnose UTI, that is urinary tract infection. So things to examine when doing urinalysis. Yeah, the color, the appearance, their color and the appearance, the chemical finding, microscopy finding too. About the color, this that is when they brought the urine, how you're seeing it. If it's cloudy, if it's clear, if it's pale, dark yellow or another color, how you're seeing it, how the color is. If the urine is clear or is cloudy. So the normal urine normally rate from yellow to colorless or pale yellow to deep amber depending on how concentrated, diluted, watery the urine is. And also, many things can affect the color of the urine. If you are taking medication, supplements, even food, some certain food that you eat can affect the color urine, such as beets. Yeah. However, the color of urine, like red color, can signify some can signify signs of disease. Yes, like red color, when urine is red, like bloody, it signifies disease or some damaged parts of urinary system. Yes. Also, cloudy urine doesn't always indicate unhealthy urine. For example, sperm and skin cells are harmless and could make your urine appear cloudy. You know what I mean, right? Yeah. Other things that can also make urine cloudy, they are cloudy. They are red blood cell, white blood cell, bacteria may indicate different medical condition, including dehydration. Yes, if you are not drinking water very well, it can make your urine to be cloudy. So it's always good for you to drink water very well. It helps. Just take enough water, either you're doing test or not. Water is good for body. Yeah. Like I was saying, cloudy urine can indicate that the patient is having UTI, that is urinary tract infection, like I mentioned. It can be sexual transmitted infections. It can be the kidney stone. It can be diabetes. So to do this urine, to do this urinalysis test, we normally use strip. Yeah, let me show you the one of the, like this, we call it combo 10. So this one of the, this is the test kit, one of the test kit that we use for urine analysis test. Yes, it will show you if the person, if the urine is having blood or bilirubin or glucose or protein or nitrate is positive or negative. So it will show you. Yeah, and this same test kit, but this one is going to be 10. It have 10 parameters, as you can see. Have 10 parameters, you can see, but this have 3 parameters. This only have glucose, protein, and the pH. The pH, it will tell you the pH. And this urine test that we are doing, it's supposed to stay for like 60 seconds. Once you dip the strip in the urine, you wait for 60 seconds before you read it to get accurate results. Yeah, so that you won't give fake results. Yes, so this is how the strip look like. Can you see? This is new. I've not used this at all. This is how the strip, you dip it into the urine, and the changes in the colors will show you. You now use it to read one thing. Once you dip it and you dip it into the urine, after waiting for 60 seconds, you use it to read the color, to see the changes. And you don't leave this thing more than 60 seconds or less than 60 seconds to give accurate results. And like this now, you have to try it. This, you don't open the thing and leave it to the hair. You always close so that it will give bad results. So a protein in urine test, presence of protein in urine tests, such as albumin in your urine or high or normal level of protein, may indicate different health conditions such as heart failure, kidney disease, and dehydration. Yes. So urine pH, you know, I said it that the strips, they have pH. Yes, all the strips have pH. The pH measures the acid base level in your urine. A high urine pH may indicate condition including like kidney issue and UTI, like I was saying earlier. So a lower pH too may indicate some condition like diabetes related to ketoacidosis and diarrhea. Yeah. So the strip, the one with combutin, has ketone too. So ketone build up your body. You know, ketone build up your body where your body has to break the fat and the fatty acid to use to for your energy. So this is this is likely to happen when, if your body doesn't get enough sugar. That is why when ketone is present, that's what I'm saying. If your body doesn't have enough sugar or carbohydrates to fuel that energy, so most often if ketone is present in your urine, we check for diabetes related to ketoacidosis, like I said earlier. Also, glucose in urine. So if glucose is present, glucose measures the amount of glucose in your urine. So under regular circumstances, there shouldn't be glucose at all. I mean at all in your urine. So presence of glucose could be a sign of diabetes. And if we are doing this urine test for a pregnant woman, it can be a gestational diabetes. Yeah. Also, if there is bilirubin, like I said, the combutin has bilirubin. If the bilirubin is positive, either 1 plus or 2 plus. So if bilirubin is present in urine, it might indicate may indicate liver bile or bile duct area. Yes, bilirubin is a yellowy pigment found in bile, a fluid produced by your liver. Yes, if there is bilirubin in your urine, like I said, it may indicate liver or bile duct issues. Yes, so nitrites is either positive or negative. So nitrite, a positive nitrite in urine test results can indicate urinary tract infection, UTI, as I've been mentioning since. However, not all bacteria are capable of converting nitrite, that is a substance that normally found in your urine, to nitrite. I hope you get me. Let me ask. What I mean is that sometimes you might even have urinary tract infection, and your nitrite will still be negative. That is what I mean by that. But if it's positive, that can indicate that you have UTI. So let's go to leukocytes. That is also leukocyte 2. It might be 1 plus, 2 plus, or 3 plus. So leukocyte esterase in urine is an enzyme that is present most in white blood. Yes, they are present mostly in white blood cell. So when it is positive, it may indicate that is inflammation in your urinary tract or kidneys. The most common for white blood cell in urine is bacterial urinary tract infection. Yeah, so let's go to the specific gravity. Yes, that is specific gravity too. So the specific gravity test shows the concentration of chemical particles in the urine. Yes, abnormal specific gravity may indicate several health conditions. Yes. Okay, let's talk about urine microscopy too. So urine microscopy finding is when you view the urine, you put a tiny substance of the urine on a slide. Yeah, on a slide. This is slide. On a slide, and you use the microscope too. Yeah, you put it on a slide, like I said, to view the urine under the microscope. So the things that we are looking for if we are doing urine microscopy: the cell, the fragments, the urinary cast, mucus, bacteria, and or other germs, crystals too. So microscopy texts that provided may include the urinalysis, So things that you can find in the urine microscopy: red blood cell, RBC. Yes, if there is elevated number of RBC, that is red blood cell, in your urine. However, that urine test can identify where the blood cell is coming from, but it means that is blood in your urine. Yes. So, for example, contamination with blood from hemorrhoids or vaginal bleeding. Yes, that is why if you are doing like urine culture, we ask the guest if the guest is not on. If we have the patient, sorry, if the patient is not on his or on her period, if she is not on her period, because the blood, if the patient is on her period, the blood can make us to see blood in the urine. So, like I said, you can distinguish. If you are checking my urine microscopy and you see the RBC is high, you can distinguish where the blood is coming from. So it can be vaginally bleeding, or it can be bleeding from somewhere else in urinary system. So in some cases, higher than normal level of red blood cell in urine may indicate bladder, kidney, or urinary tract tract issue. So white blood cell. So we should also check white blood cell in urine too. Increase in white blood cell in urine or positive test for leukocyte. Like I said, if you are doing urine analysis, the positive test for leukocyte may indicate infection or inflammation somewhere in urinary tract. Epithelial cell. We also see epithelial cell in urine microscopy. Epithelial cells are cells that form the covering on all internal and external surfaces of your body and line body cavities and hollow organs. Your tract is lined with that epithelial cell. It is normal to have some epithelial cell in your urine, but elevated number when it's too high, it may indicate infection. Yes, infection and cancer in your urinary tract. Yes. So moving forward, bacteria, yeast, and parasites. Sometimes bacteria can enter urethra or urinary tract, causing urinary tract infection, UTI. So the urine sample can also become contaminated with bacteria. For some people with a vagina yeast can contaminate the sample. For people, yes, when you have yeast infection, it can contaminate. Yes, the vagina that have yeast infection, it can contaminate it. Trichomonas vaginalis is a parasite that may also found in urine. In the people that have STI, yes, people that have STI like trichomoniasis. So urinary cast. Cast are tiny tube like particles that can sometimes be in your urine. They are formed from protein released by your kidney cell. Certain type of cast may indicate kidney issue while others are completely normal. So why do you need urinalysis? Yes, in the hospital where I work, I think it's normal. Like for all pregnant women, yes, when you are pregnant, once you are coming for antenatal, you do urine test, that urinalysis every time. Like once is your antenatal day, you are doing urinalysis test that day to check if there is anything to look out for. And if you are experiencing any signs or symptoms of some health condition like such as diabetes or kidney disease, you have to do urine tests to also monitor the health condition you are maybe when you are receiving treatment for such as diabetes, or when you are receiving treatment for diabetes or kidney disease, and to also diagnose urinary tract infection. And also if you have been admitted to hospital, and also is also preparatory checkup for surgery. If you want to have surgery, these are one of the tests that doctor we have to send you for to do to prepare you for your surgery. Okay, so let's talk about how to get a good urine sample. Yes, that is also important because any result, the collection can affect your urine test. Yes, the collection can affect your results. So if you want to get your urine, you first start by sitting on the toilet seat, like clean toilets. You know that, right? So you spread your leg apart. You use your finger clean. You might have washed your hand by then, please. So you use your finger to open your labia. I'm talking about for women. Yes. To open your labia, then use sterile wipe to clean your inner foot of your labia. You wipe from front to back. You understand, right? Not from back to front, please. From front to back. If even when you normally when you go to toilet normally, is it always good for women if you want to wipe, you wipe from front to back so that you won't carry infection from anus to somewhere else. That is the best thing when you're wipe. When even after using toilet for a woman, it's always good to wipe from front to back. So after wiping your urethra, you pee small inside the toilet. That means you pee small and you hold the urine. You put the cup, I mean the urine container, you put it not too close to your urethra, please. Give space. Don't let it touch your urethra side at all. So after peeing little in the toilet, you stop the flow, you hold the urine and pee little, my dear. You don't have to fill the bottom, just little. Time is it's okay. Just little is okay. Yes. So after, like I said, after holding it, peeing little into the toilet, then you hold the cup not too close, a bit, like few inches from your urethra, and you peel little, like half full, to the urine container. Then you now peel the remaining inside the toilet, or you finish the remaining inside the toilet. And always remember, please cover it back, cover it very well so that it won't spill. Yes. And you clean after covering. Even if it's a male, it's always good to, once you want to get the urine sample, you clean your penis. After cleaning, you pee small into the toilet, then open your container, pee small into it, like half of the bottle, then cover, then finish the remaining inside the toilet. So thank you for listening to me, thank you for watching, and have a healthy life and have a great day. Bye. Thank you.